thank you everyone for joining. Today, we will be covering a step-by-step guide testing for Zephyr valve. So we're very excited to share this information with you. Should be very educational and helpful along your Zephyr valve journey. First thing we want to share with you, a few housekeeping items. We want you to be able to submit your questions into the Q&A box. So if you scroll down and you see, a bar that has a little chat bubble, that is where you can submit questions, as well as the Q&A, which has two double bubbles. And that is what we will use when we are doing our Q&A live at the end. So please be sure to submit those during the presentation. We also will be sending you a follow-up email with helpful information after the webinar. So we hope that that will also guide you along the way. This is part of a webinar series. So we have 4 total, and we also have these on our website. So you can view the other ones recording wise, so you can watch them on demand, but you also can register for our next upcoming webinar that tells you more about what to expect before, during, and after the procedure, which is coming up in September. So we hope you can join that. So without further ado, we'll pass it over to Nancy Collar, who is our speaker today, with a breadth of knowledge that we are so excited for her to share. Nancy, go ahead.
Yeah, hi everyone. Thanks so much for having me today. I'm excited to share a little bit with you guys about how the Zephyr valve procedure can help you breathe easier. So I'll tell you a little bit. I'm a respiratory therapist. I've been doing this for about 37 years. I love what I do. I currently am the lung navigator for our interventional pulmonary team here at Inova Fairfax Hospital in Falls Church, Virginia, right outside of Washington, D.C. We are excited to be we've just treated our 100th, I say unique patient. It's a patients that have come for the first time. We have patients that come to us from all over the country as well as the world. We have somebody coming to us soon from South Africa. So love what I do, love to help people breathe easier. Certainly, I'll go over how you can find a center close to you during my presentation, but anyway, welcome. All right, so here's a quick agenda of what we're going to go over today, the different tests basically that you will be asked to go through if you desire to be worked up to see if you would be a candidate for this procedure. So the first thing I want to focus on is when you're diagnosed with emphysema. Now keep in mind, emphysema falls under the umbrella of COPD. COPD stands for chronic obstructive pulmonary disease. A lot of pulmonologists and a lot of people in the medical field interchange emphysema and COPD. So try not to get caught up if your doctor uses emphysema or COPD. We usually mean the same thing when we talk about that. We rarely will say COPD when we're talking to an asthma patient or a patient with chronic bronchitis. We'll rarely use the term COPD. So first of all, when you're diagnosed with emphysema, one of the first things that your doctor is going to do is prescribe medications to help you breathe easier. You guys all are probably already on some of those medications. You'll need to continue to follow up with your doctor about fine-tuning those medications. The next thing that all patients that are diagnosed with emphysema should be directed to do is attend a pulmonary rehabilitation program. That's vital to your better breathing. It helps you understand not only how to exercise to help strengthen those muscles that are helping you breathe, but it also gives you education about your disease, about how to do activities of daily living while, breathless. Those kind of things. We have an amazing virtual program that our program here at Inova has been using. It's available nationally as well as throughout the world, as long as you have an internet connection. So there are options for you if you happen to live in an area where pulmonary rehab, some of them are still shut down from COVID. Some of them just never came back up. So if you need that resource and your pulmonologist isn't aware of it, you certainly are welcome to reach out to me. So the next thing that we're really excited that has come into fruition in the past, I guess 2018, is our minimally invasive Zephyr Endobronchial Valve procedure. And we call that bronchoscopic lung volume reduction. So that's a really big fancy medical term for lung valves is what I usually say. Other options after that are lung volume reduction surgery, which obviously that's a surgery, you're being cut open. The lobes, the two upper lobes of your lung are being removed. So it's a permanent thing. Carries with it a lot of healing afterwards. And then lung transplantation. So some of our patients that we do valves on can go on to these other two procedures. So the valves do not preclude you from these if that should become something that you needed to do down the road. So we have a lot of patients that got valves and now have gone on for lung transplantation. So, all right, next slide. So we have some criteria that we look at to determine if you're going to be a good candidate. And what we mean by that is, will you get benefit? It's not really about, oh, you don't meet all we can't check all the boxes. It's really, if we do this procedure, will you feel like you can breathe easier? That's really what we're looking for. So the first thing we want to know, obviously, is we do this for patients that have a confirmed diagnosis of severe COPD or emphysema. That's based upon your pulmonary function test that you do at your pulmonologist office. Most of you have to stop to catch your breath often, even when taking your medication as directed. So you still can't complete, a paragraph, for instance, or 2 or 3 sentences without having to stop and, catch your breath. And then on your pulmonary function test, we want to see one of the values. It's called FEV1. We want that to be equal to or less than 50%. And that's the amount of air that you can blow out in that first second of your breath. So your doctor, your pulmonologist probably has been telling you about percentages and numbers, and that usually is what we call the FEV1 FVC. So it's a different part of the test that your pulmonologist normally tracks and normally reveals or conveys to you. That's how they determine the severity, is based upon that separate number. So that's just a little bit about that. Next slide. All right, so we're going to go over the pulmonary function test. And again, I would encourage you to go to the mylungsmylife.com website, look at their resource page, go to their videos, and all of these tests are explained in a really nice video there. These are some of the slides from the video as well, that just explains really nicely all of these tests. So the first test, pulmonary function test. So hopefully this looks a little bit familiar to you. If it doesn't, then this is a test that is required to determine if you'd be a candidate. I just call it the body box test. It has a really fancy term called body plethysmography. You don't need to remember that. It's just, you do need to get into this clear box. And yes, the door does need to be shut. And that's because we need to measure all the air in your lungs. And this is really the only way to do it accurately in a patient like yourself who has emphysema, who has, by definition, a lot of trapped air. So you get into this body box, the respiratory therapist instructs you on different breathing techniques, which I will be honest with you, are not easy, especially for you guys with emphysema. So we understand this is a very, very difficult test, but it also is very important. If there was another way for us to measure this, we would. So basically, you're going to be instructed to do some different types of blowing, panting, and then we're going to take 3 different measurements from this test to look and see if you would be a good candidate. But again, the most important part of this particular test with the body box is that amount of air that's left in the lung after you've blown out everything you feel like you can blow out. You're like, my lungs are empty. They really aren't. And yours with emphysema really have a lot more air than even normal lungs. All right, next slide. The next thing that we're going to have you do is a CAT scan. It's a CT of your chest. You guys probably mostly have CAT scans for lung cancer screening, I would assume. If you don't, you probably want to check with your pulmonologist, because you probably qualify for lung cancer screening CAT scans, which should be done yearly. This CAT scan is going to be more of a high resolution CAT scan, a really specific CAT scan that we want to look at really thin slices. And so when I say that, that's kind of the equivalent of if you were going to take a picture with an old Polaroid camera versus one of, let's say, an iPhone 13, or even better, a professional camera like a Canon or something. The quality, the pixels are much higher. They're more pixels, which makes the picture brighter and crisper. That's kind of a good analogy of this type of CAT scan that we need. We need a lot of images, really good, high quality photos of your lung, because we're going to then upload that to a Pulmonx software called Stratix that's going to give us some really fine details about what % of your lung tissue is destroyed with emphysema. So I call that an emphysema score. It's going to give it to us by lobe. So this picture on the bottom right is a little hard to see, but you can kind of tell that there's 5 lobes in your lung, 3 on the right, 2 on your left. And it's going to give us those destruction scores by lobe. So that's really important. And that's how your doctor is then going to decide what lobe is the target to place these valves into. It also tells us the walls or the fissures between each of those lobes. Those need to be complete. And as you do your testing, your coordinator will explain more about why that's important. So that's why this CAT scan is really important. Okay, next thing that honestly is not a mandatory test, it is optional, is an arterial blood gas, or an ABG, we call it. It is a blood test that we draw. We draw that from your artery. Usually it's the artery in your wrist. And the reason that that's important, the reason that's not just a regular blood draw like you probably had done a lot, for regular blood work, this is a special test because the arteries carry the oxygen in your body and also the carbon dioxide. So we breathe in oxygen, we blow out carbon dioxide. One of the problems with emphysema is your body's ability to get rid of carbon dioxide, as well as your body's ability to use or uptake oxygen. So it's really important for us to look and see, are those values within a certain range? As a rule, your values are going to be, your oxygen level is going to be lower than normal and your carbon dioxide is going to be higher than normal. That's where you guys live. That's just a standard that we all expect. So talk to your doctor about whether this test is absolutely required. And if it is, then the respiratory therapist drawing the blood, I'm sure will do an excellent job and make it as not pain-free, but as painless as possible. So it is a quick test. We get the results very quickly. And then they would follow up with you about those. Next test is a 6-minute walk. So the number one question that I always get from my patients is, I can't breathe. How do you think I'm going to walk for 6 minutes? And so what I want to tell you is we're not asking you to run a marathon. We're not asking you to even walk the entire 6 minutes without resting. All we're asking you to do is participate in the test for 6 minutes, which means don't quit. Once you start walking, keep walking. If you need to stop to take a little break, stop and then continue. Okay. You are allowed to be on whatever oxygen is required, whatever oxygen your body requires during this test. This test is not to determine the amount of oxygen you need. That's a separate test that sometimes is also called a 6-minute walk test, but that's more for oxygen qualification. In this 6-minute walk test, we're simply looking at distance. How far can you walk in 6 minutes? And we're going to compare that. That's used in a lot of different programs to see how patients like yourself with emphysema have improved after pulmonary rehab, for instance, or after lung transplantation, or after this Zephyr valve procedure. We want to see that number go up after we do the procedure, which indicates that you have improved. Next test is an echocardiogram. I like to just call this an ultrasound of your heart. Most people have had an ultrasound of some kind. So this test takes about 45 minutes. The reason that we're looking at the heart, as most of you probably know, our heart and our lungs are connected. They work together. And so sometimes patients can have issues with their heart that are actually contributing to shortness of breath. And so if we're going to do the valve procedure on you, we want to make sure that we've either optimized or eliminated any other reasons for your shortness of breath besides the emphysema. Because when we follow up with you after the procedure, we want your shortness of breath to be able to be monitored, or you to assign a score to it that's indicative of just your lung disease and not other factors that might be causing shortness of breath. So I'll give you another example: belly fat. One of the things that I don't think we're going to go over necessarily, but we do have a BMI cutoff for this procedure. And some people might say, why? And that's because belly fat actually also contributes to shortness of breath. So we want you to reduce that belly fat so that your lungs actually have more room to breathe and can do their job. So the same with the heart. The left ventricle, or the left bottom part, is our pumping chamber. That's what actually makes our blood pressure. That has got to be pumping effectively for you to not get short of breath. Otherwise, blood backs up into the lungs and you get short of breath. So we want to look at that number. The other number we're going to look at is your pulmonary artery. So it's the big vessel coming from the right side of your heart into the lungs. If that number is high, then that's going to cause shortness of breath. And that number can be high for some different reasons that we'll evaluate. So that's why we do the echocardiogram. If the numbers are outside of the acceptable range, then your team will send you to a special cardiologist. Our team has a team of cardiologists that we deal with that understand the valve procedure and that then can do further testing to help us determine if this patient can be optimized or if this patient just is not a candidate for the valves. All right, next test. So this is what we call a perfusion scan or a blood flow scan. So after we've done the CAT scan of your chest, which is looking at the airflow and looking for things like nodules and other things like that, we also want to look at the blood supply, because let's say that your doctor has determined that your right upper lobe, for instance, is the target lobe that he wants to place these valves in. That means that that lobe is now going to be deflated with the valves. We want to ensure that the blood supply to that lobe is also low. We don't want to deflate a lobe of your lung that has the most amount of blood supply going to it. So that's why this, we call it a SPECT CT. That's why this is so important, is to make sure that we know what the blood flow in each of the lobes of your lung is compared to the destruction in each of the lobes of your lungs. And then we look to see what the best target. So this is really helping us fine tune that best targeted lobe for you. This is another radiology exam. It does require some dye to be injected. So that's done through a little IV that's placed in a vein. It's about a 45-minute test. So a little longer than just a quick CAT scan, which is literally about 5 minutes. But it is really, really helpful to have this done. All right, so some common testing questions that we get. We're going to go ahead and address those now because that might be the majority of your questions. Is, can your current doctor do any of these tests? Yes. Your current pulmonologist should be able to do all of these tests or order all of these tests. Most of our pulmonologists can do pulmonary function test. Most of them can do the body plethysmography. All of them can do a 6-minute walk test. All of them can order an echo, a CT, and a SPECT CT. So there's really nothing that they can't go ahead and do. Your center that's close to you, your coordinator will let you know what that looks like. I'll just say, for instance, our center, because we're part of the National Registry, we do all of our testing at our hospital, unless you come to us with all of your test results. That's the only way that we take tests from outside. It's too much piecemealing together. So if your outside doctor wants to order all of these, certainly let them know, here's everything I need. And then you can call the coordinator once you have all your results. Can the test be done in one day? Absolutely. Because we have patients coming from a distance, I always schedule the test in one day, but I have to be honest. And I tell all of my patients this, it's a long day for you. It's morning to night. It's 5 tests, plus usually an office visit with the doctor. The pulmonary function test alone takes about an hour and a half. The 6-minute walk, you might say, oh, what's 6 minutes, right? Well, maybe, but maybe you need to rest before you do it. You definitely will want to rest after. So that's about 30 minutes. The echocardiogram is about 45 minutes. The SPECT CT, the perfusion scan, is about 45 minutes, and the CAT scan is only about 15 minutes. So it is an all-day procedure, but it definitely, all-day testing, but definitely can be done all in one day. It just takes some coordination with all the timing of things. There's no such thing as failing the 6-minute walk. I get that all the time. Well, what if I failed it? Well, I don't understand what that means because we're just looking for how far can you walk prior to your procedure versus after we do the procedure. So I will give you an example. If you can't walk at least 100 meters, we're going to require that you go to pulmonary rehab and get to at least where you can do 100 meters in 6 minutes. That's very doable. It's not, I've never had a patient that originally couldn't do 100 meters that after 2 weeks of pulmonary rehab could now do 100 meters. I hope that makes sense the way I worded it. So increasing your 6-minute walk distance is pretty easy with some pulmonary rehabilitation. And that's really muscle strengthening, focusing on your chest, core, and shoulder muscles. Those are the muscles that help you breathe. So yes, there's really no such thing as failing. You do your best, participate in the test, keep walking. You'll be able to do at least 100 meters. And then how long before you get the results of the test? So most of the tests, we have the results within just an hour or two. The CAT scan, though, like I said, we upload that to a secondary software that Pulmonx has. And that usually takes about 5 to 7 days for us to get those results. So your coordinator probably will not call you for about a week after the test, just because they want to have all of the information. We, at our center, we do not disqualify a patient just based upon one test value. We look at the whole picture. Will the patient benefit? Will the patient feel less short of breath after this procedure? And we really have found that CAT scan, that StratX analysis is really critical in our ability to answer that question with as much of an educated guess as possible. So, all right. So how do you find a doctor? It's actually go to the mylungsmylife.com website. There's a link at the top that says find a Zephyr treating physician, and you simply plug in your city and it will tell you, it will show you a map, as you can see here on the right. It will give you the doctors, the facility name, the address, the doctor's name, and then their coordinator's name and contact information. So that way you can contact them. And let's say that we have a lot of patients whose kids live in one area and they live in another, and they want to come stay with their kids and have this procedure done. That's a possibility for you as well. So if you live someplace different than your children or your support system, I should say, you don't have to go in the area exactly where you live, but this is how you can find a place, really any center throughout the country, this website. So get familiar, please, with this website. It's amazing, has a lot of great resources, and I think will answer a lot of your questions.
All right. Thank you so much, Nancy. You covered so much. Appreciate that. And right now, next thing we're going to do is we're going to answer some of your questions. So I think you may have had some trouble adding things into the chat earlier, so you should be able to do that now, as well as into the Q&A box. So let me go ahead and one moment. Let's see here. What do we have? First question we have here, Nancy, is I've had all these tests done a few times. My oxygen level is at 17%. Would I qualify?
I would need to know what you mean by 17%, because that number doesn't make sense to me. So yeah, because the amount of oxygen in the air that we breathe is 21%. And when we quote like saturation levels, for instance, 17% wouldn't be compatible with life. So I don't think that that's what you're talking about. I'm trying to think of a pulmonary function test. Maybe you're talking about a pulmonary function test. Maybe one of those values is 17%. In that case, you would qualify. You would be on the lower end of that. So yeah, that would really require discussing that with the coordinator so that we understand what exact value you're talking about.
Great, thank you. We have someone here asking about, can you post a link to a virtual pulmonary rehab? And I believe, Nancy, do you guys have one?
Yes, let me see if I can find the.
You don't have, we can actually find it and share it in our chat.
Yeah,
but
it's called Home Rehabilitation Network.
Okay, great.
Mm-hmm.
And can you talk a little bit about how important pulmonary rehab is?
Yeah, so pulmonary rehab, I was talking earlier, and you've heard, most people have heard of cardiac rehab because heart disease is very prevalent in our society. And obviously cardiac rehab is really important to all of those patients. Pulmonary rehab has a different focus. Cardiac rehab, your focus is going to be aerobic activity and eating less fat. Pulmonary rehab is really more about strengthening the muscles that help you breathe. So I mentioned this briefly earlier. So they're called your accessory muscles of breathing. They're your chest, core, and shoulder muscles. So think an easy exercise you can do at home that doesn't require any equipment are wall push-ups. Stand about a foot back from the wall, put your arms up on the wall, and then do a push-up. If that's really easy, push your feet back a little bit. Do another wall push-up. Do 3 sets of those, 3 sets of 10 a day. That by itself, you're strengthening your chest, shoulder, and core muscles with that one exercise. So it's those type of exercises that are valuable to strengthen those muscles. So when you think about the diaphragm is the big muscle of breathing underneath your ribs. And if you'll watch some of the videos on the My Lungs, My Life website, you'll see what I'm talking about. That diaphragm is designed to help us breathe. And it should do this. It should come up like a nice upside down U when you breathe out. And then it should drop down as you breathe in and your lungs expand. With emphysema, instead of it coming up and down like this, it goes like this. So I was giving the example earlier of take a deep breath. And if you have emphysema, don't do this. But for patients who don't have emphysema, this is how I give them example of how you feel with emphysema and how you breathe. And then breathe at that level. You can do that for a little bit. And then after a while, you're like, oh my gosh, I can't get any more air in. I got to get my air out. That's how you feel all the time, but you can't just get the air out because the elasticity in your lungs doesn't allow that tissue to cinch back in like it should. So they stay hyperinflated or with too much air. And so your diaphragm, because it can't do the work that it was designed to do because of what I just explained, your body is now using those accessory muscles of breathing to help you breathe 24/7, 365. People with normal lungs only use those accessory muscles of breathing when we exercise, when we get really stressed. You have a stressful situation and you start hyperventilating, you're using those accessory muscles of breathing to help you breathe. So they're not meant to do that 24/365. Okay. So that's the importance of pulmonary rehab, is not only to learn specific exercises to help strengthen your lung muscles, but also to give you education about how to take the medications. Do you use a holding chamber with your meter dose inhaler? Do you take a deep breath and hold it, or do you suck in really fast? Like, how do you take these different inhalers? There's different techniques based upon the inhaler. How much oxygen are you on? Is there a device that weighs less that you might qualify for? Maybe you qualify for what we call nocturnal ventilation or nighttime support that allows your respiratory muscles to rest at night so that during the day you have more energy to breathe. Those are all things that a pulmonary rehab program will address with you. So pulmonary rehab is critical and is different. Another thing I was mentioning earlier is the foods that you eat. Patients with emphysema, like I said earlier, as a rule, have a higher baseline carbon dioxide level than normal lungs. Carbohydrates that we eat produce carbon dioxide. So patients with emphysema really should be on a low carbohydrate diet, not necessarily for weight loss, but for CO2 production. You don't need more carbon dioxide in your body that your body is not able to effectively get rid of because of your disease. So.
Great, thank you so much. Here's another question. You may not be able to answer this, but I've had a transplant. Would I still qualify?
That's a good question. I can honestly say I haven't had that question before because by definition, you no longer have emphysema.
Okay.
So I would think no, but that would be something that I think the team would have to kind of put their heads together and say, here's an out of the box, patient.
Creed, would you have an
So,
answer
yeah,
for that?
I can jump in really quickly. So if this is a bilateral transplant, probably the answer is no, but I'm assuming if it's a single lung transplant, we've had several cases in Europe where the native lung, meaning the non-transplanted side, ends up hyperinflating and pushing down on the transplanted lung. So yes, there is history in us having treated the non-treated or non-transplanted native lung. If it's a bilateral, I just saw that. Yeah, I don't know if we have any history treating someone who's had bilateral, but depends upon how far long ago it was and what's happened to the disease in the lung now, so on and so forth.
Great, thank you.
Sure.
I know you answered these a little bit, Nancy, earlier, but I just want to reiterate it for them. So can you talk a little bit about one, failing the walk test, and also if they can use oxygen?
Absolutely, you can use oxygen. This is not an oxygen challenge type test. We're not trying to see how much oxygen you require at home. That's a different type of test that can also be called a 6-minute walk test. So I understand that's confusing. Our goal for this particular test is distance alone. So we want you to walk. I mean, if you can't walk at all, I mean, we have had a couple patients who physically they have issues with walking and they can't. That's a different story. If you're able to walk at all and your shortness of breath is truly what's limiting you, then just participate in the test. Walk, stop, take 3 steps, stop and take a breath. Take 3 steps, stop and take a breath. Just participate in the test for 6 minutes. And then again, make sure that you're in pulmonary rehab. And I guarantee that as long as you physically can walk, that number is going to go up.
Great. And then this is a question, not particularly about the test specifically, but can valves be put in more than one lobe?
They can. So as a rule, if I don't know if we can pull up the picture of the lungs. I like this, just a Stratix picture, but like I said, there are 3 lobes of your lungs, 3 lobes in the right side of your lung. And it's pretty common for us to do the right upper and middle lobe together. So technically those are 2 lobes. The middle lobe is pretty small, but technically it's 2 lobes. So that's done pretty routinely. Now, if you want valves on both sides, so that would be 2 separate lobes, but on 2 different sides, some centers are doing that. That would be a center by center and a physician determination. At our center, we do, but we do them separately. They're separated by at least a year. So we'll do the valves in one lobe, track the patient, make sure that they're improving, and then assess them a second time if they want to do valves in the opposite lobe, or we call it the contralateral, the other side. So it's possible.
All right, great, thank you. And then can you talk a little bit about the recovery time post-procedure?
So the procedure is a quick, maybe an hour-long procedure, depending on your physician. You are put under anesthesia, so you are put to sleep. A long camera is thread down through your lungs. And again, take the time to go to the mylungsmylife.com website, look at the resources and look at the videos. And there's a nice video that shows you about this. The valves are then placed, you're woken up, you're admitted to usually a general floor, and you need to stay. Right now, Medicare requires a minimum of a 3-night stay. So that's what most facilities are continuing to abide by, is that 3-night minimum stay. So I say 3 sleeps. Don't get caught up in the days, day 1, day 2, go by nights. How many sleeps do you have? And the first day, normally, you are on complete bed rest. And I tell my patients, we're trying to baby your lungs, because if I've deflated one of the lobes of your lung, then the other lobe in that lung is now having to take over that work. So sometimes that lobe is now like having a party in there. Woohoo, I could stretch in all these different ways because I have more room, and think the elasticity in that lung tissue is already destroyed. So now if it stretches a little bit too much, then it pops a hole. So picture that balloon that you blow up that one extra time and it pops. That sometimes is what happens to that lobe on the same side as where we place the valves, and you get a hole in that lung. It's a microscopic tear. It's called a pneumothorax. That's the medical term. We just say hole in the lung. It happens about 25 to 30% of the time. So it is something that everyone on your team is watching for. There are signs and symptoms that are very clear to to see, and they're on top of it. They'll have all the equipment at the bedside that they need to do to treat that. And your doctor will get that treated just as quickly as possible. With a tube that then allows the air to come out of your chest so that that hole can heal. How long that hole takes to heal is patient dependent, but it will heal on its own. So
great. Thank you so much for answering all these questions, Nancy. Really appreciate it.
I can't emphasize enough. Go to mylungsmylife.com. Click on resources, go down to the videos, watch the videos, just soak in as much of the information on this website as you can, because it really is incredibly helpful. It's worded the way that you will be able to understand it. And yeah, reach out.
All right, thank you so much. All right, so like Nancy said, please visit our website. There's a tons of resources for you to watch, videos. There's other webinars you can look at. And then also there's articles that you can read about too to continue understanding your disease. You can also call our Zephyr Care team by calling 833-654-COPD. So speak to someone live. We also have chat on our website. So you can also chat with someone if that's more comfortable for you. So we are definitely here for you. And we hope you have a wonderful day. And thank you so much for joining this webinar today. Thank you.